Hi, everyone. I'm Steve. I'm here with Dr. Nario, and we are going to talk about Ibogaine, something he was just telling me about. And it's not, well, I'll get into the questions, but thanks for being here, Doc.
Hi, Steve. Thank you for having me again. Always a pleasure.
All right. So, Dr. Nario is with Biointegrative Health Center in Reno, Nevada. You can check them out online and see all the things that they treat. So, Ibogaine, this is, you said you've talked to some people, and I guess they go out of the country to get it.
Yeah. So, Steve, in the world of anti-aging medicine nowadays, so I encounter all of these things that we're talking about psychedelics, talking about mushroom therapy,
Like
ayahuasca.
70s drugs.
Yeah. So, yeah, peace, man. So the hippie era is starting to now make sense for, I guess, for our patients because now they're discovering all of these psychedelics to actually be beneficial. So now we're going to be talking about a compound that sounds like it belongs to a movie, Ibogaine, and it's being called really now the brain reset, an addiction interrupter, a near-death experience in a molecule, and yet it's also one of the most controversial substances in medicine. So why is it that anti-aging and longevity community is actually talking about it? Because ibogaine doesn't just change behavior. It appears to change neural wiring or rewiring, stress response, as I mentioned to you about cortisol, and the meaning to what why things are. So which are all deeply tied to how we age. So that's why this is how it got introduced to me. Because I do have patients who are talking about this. This is not in the US. This is banned. I just want to start the education with our audience here on what it is, what it can contribute to our health. And of course, everybody needs to be updated on what the trends are.
Yeah, so that's very interesting. What most of your patients must be baby boomers, huh?
Well, for sure, they're happy when they're doing we're doing these things. They know how to get the resources. They know where to go. And as I mentioned to you, this is one of the rare ones because ibogaine is naturally occurring. It's a plant. It's the iboga plant, and traditionally used in West Africa. In terms, we call this now spiritual ceremonies. So you can see how deep this goes. And in modern medicine, it becomes famous for one reason: people with severe addiction would take it once and cravings disappear for weeks, for months, and sometimes even permanently. So that got scientists' attention. Even our science got it. And ibogaine is not a party psychedelic. I have to repeat this. It's not relaxing. It's not euphoric. It's more like your brain has scheduled a mandatory life review of all the trauma and actually pushed the reset button on it. So that's why it's just I just mentioned to you about the take it once, how much effective it is in terms of the notable effects.
So you kind of answered the next question I was going to ask. And that question was, why are people interested in this? Why are they talking about it? Why are they trying it? Why are they going to other countries to try it? You said they go to other countries to try it, and then they just come back. They try it one time in another country and they come back. So
Right, right. That's
you,
true.
you, some of the reasons why they might be interested in this, but what else can you tell me about why people are interested in this and why they're talking about it?
So let's talk about the longevity space. So aging isn't just physical decline; it's also related to rigid processes or patterns, chronic stress loops that we just can't get out of, trauma stuck on just on a loop or a repeat mode, even loss of psychological flexibility. So ibogaine appears to affect neural plasticity, so memory reconsolidation, emotional processing, and stress response recalibration. So longevity isn't about keeping the cells alive; it's about keeping the mind adaptable. So that's where ibogaine enters the conversation. And again, ibogaine is pharmacologically messy if you think about it in a fascinating way. So it interacts with so many receptors. It's the NMDA, the serotonin, the dopamine, the opiate receptors. So all of these receptors are getting activated by this one simple herb. In translation, though, it disrupts the rigid brain loops and it promotes neural reorganization. So the metabolite noribogaine lasts longer and is linked to mood stabilization, reduced cravings, and even emotional clarity. So when I mentioned cravings, we're talking about cigarette, caffeine, alcohol, or even addictions, as we call it. So think of Ibogaine as a system reboot, not a tune up.
So you talked a little bit about, studies in this country and FDA and all that stuff. And it sounds like there's some fear of some substantial dangers of taking this. What are those dangers?
So the real danger behind this really is, so Ibogaine is not safe for casual use. There's a reason why when it got into the US, it actually was moved to a Schedule 1, meaning very restricted. So, because it was actually ran through clinical trials, and during the trials, they found that Ibogaine has known serious side effects, such as cardiac arrhythmias, meaning the rhythm of your heart becomes funny, the QT prolongation, meaning the heart is just beating longer than it should be. Electrolyte instability and rare, sometimes deaths that were done for this. That's why it's illegal in the US. It's only used in medical settings in a few countries, and screening is very critical. And I told you about the stories that I heard this from my patients that they did it in a different country. So these countries probably have fewer regulations on this. And important anti aging truth, though, a therapy that shortens life is not a longevity strategy. So this is not biohacking. This is really more medical level intervention. So that's why everybody needs to understand this, especially for the ones who are very extreme. I have these patients who always wants to try something new, but this one, I don't know if my thumbs are up or thumbs are sideways or thumbs are completely down. So these are just I really dug into the literature a little bit more because I've been hearing a lot of patients starting to show up. Hey, ibogaine's good, ibogaine's that. So we really need to get to the medical facts here.
So you've had some patients, I think you said, tell you that this has been life changing.
Yeah. So Ibogaine again became famous for interrupting addiction specifically, not suppressing it, but resetting it. So people describe this as vivid autobiographical memories, confronting trauma, seeing the life patterns clearly, and loss of compulsive urges. So that's huge. If you're like a gambling addict, right? You just go on repeat all the time. This matters for aging because addiction accelerates aging. So usually the things that we're addicted to are the bad things, right? Bad food, right? Bad exposures. Chronic stress ages the brain. So unresolved trauma drives inflammation. So breaking those loops can downstream effects on sleep, metabolism, immune tone, and even psychological resilience. So I think this is also, I know we have audiences also all over the world. So this is something probably whoever's trying this, at least you are now knowledgeable on what risks you are going through and what benefits you will probably get from the actual therapy.
Yeah, I guess it could be life changing if it kills you.
Well, true. There's no more life after that.
Yeah, that would be a kind of a big abrupt change.
Yeah. Well, again, I would say that ibogaine is not like psilocybin microdosing, ayahuasca ceremonies, ketamine therapy that we hear that's being given IV. So those are lighter, repeatable, safer, and when supervised, especially ketamine has been being done in clinics now through IVs, Spravato, like nasal sprays. So ibogaine, I have to tell you, is pretty intense. One time or rare, of course, as I said, one time use is very beneficial already for users. Physiologically demanding. So if psychedelics are a spectrum, microdosing probably is called a daily stretching. Ibogaine is probably surgery. It's like a big deal. So this is one of the bigger punches that this herb can actually do to us.
So I guess this longevity movement, hacking and all this stuff is people are looking into all kinds of stuff like this, right?
Yeah. So again, ibogaine. I mean, when it enters the anti-aging longevity field, as I told you about the discussions that I have with patients, they kind of have sometimes this misconception that ibogaine can actually lengthen telomeres, boost mitochondria, reverse wrinkles, right? But again, as I said to them, that's probably an indirect effect of ibogaine because it indirectly may reduce allopathic stress, resolve trauma, restore psychological agency, and improve long-term behavioral change, which can probably lead to lengthening of telomeres, boost mitochondria, and even reverse wrinkles. If you're always like so problematic, of course your forehead wrinkles are always like crunched up. So those factors strongly influence inflammation, brain aging, and cardiometabolic health. So the longevity is just not about living longer, it's about not being trapped in old patterns.
Why can't you just have a beer?
People are carb conscious. They don't want to have that gut that will ruin their six pack.
All right.
Well,
So,
yeah. So who knows, right?
is there anything that I should have asked you that I didn't ask you?
So Ibogaine right now is getting traction. Meaning, when I say traction, it's being studied by medicine in the US. So, for example,
Really?
University of Houston actually allotted funding for the study of Ibogaine in relation to PTSD and trauma. So right now it's still in the works. Again, there's just so many unknowns about it, but I think in the future, if there is something of a potential that we can see about Ibogaine, there is. But right now, I just don't want our viewers to. Would you want to take a chance? Would you want to make a calculated risk? This is the reason why we're here. We want to explain to you guys if you are going to be making a wise decision or a wise choice, if you are going to be jumping into this type of therapy.
Yeah, I guess. Do a lot of physicians know about this? Are they aware of this?
Unfortunately not, because this is what we call herbal medicine. I mean, this falls into that classification. It's not a supplement, it's not a peptide, right? But it's definitely something that has not been taught in medical school for sure. Because how I even dug a little deeper into this is because of my patients who actually had gone through it, and my curiosity kind of ran so deep that I wanted to know, like, what is this drug herb that they're talking about that was just life changing for them? So curiosity is where everything starts. And as you now proceed to that, now bigger studies and milestones will be now the next step for the utilization of this herb or drug in the future.
How do your patients find out about this stuff?
Well, in an anti-aging clinic, you really find the extremes. And I told you, the biohackers, the gym people are the ones who we really should thank for, because they're actually going through a clinical study that actually does not even need consent from us. So they're kind of sparking that flame so that, wow, we should look into this because this person said this was the effect. And can we apply that effect now to massive amounts of patients or people?
So I assume they're learning about this, doing research and digging into it on their own,
I'm sure
maybe
TikTok
even trying it.
is a big resource for this.
And then they ask you about it.
I know. And
And
the
then
thing there
they
is,
ask you, well, what do you think? Right?
I know, and I'm the one who looks dumb because I'm so delayed in my information, so I need to catch up. I mean, AI is here, TikTok is out there, Instagram. I need to get my resources all lined up.
All right, Doc. Any last thoughts on this? Ibogaine?
Yeah, so Ibogaine is powerful. It's fascinating. It's not for everyone, and it's definitely not casual. For the anti-aging world, Ibogaine teaches us something important. Deep healing sometimes requires deep disruption. So longevity isn't about chasing extremes. It's about choosing resilience, safety, and sustainability. So your brain can change, your patterns can change. Just don't confuse transformation with recklessness. So make the wise decisions and ask your doctor anything about therapies that you want to try. So at least you're medically guided. So even your doctor who doesn't know about it would start researching it. And the best ones to really find out about the pluses and minuses of specific medical therapies are your doctors.
Yeah. So I guess if you do, I mean, nobody's going to recommend or suggest that anybody goes to a foreign country or go to south of the border to try anything like this. I mean,
Yeah,
that
you will
sounds
hear this
kind
a
of
lot being
crazy.
done by shamans, by spiritual priests. So these are things that I guess that's a medical expert in their country, and they know how to mitigate the risks here. But still, we still want to know us doctors. That's why we learn from you guys. Give us everything that you're doing. We'll find out for you, and at the same time, we will help other patients because of your experience.
I guess so. You could see like a witch doctor in another country, right? And those are
Yep.
doctors.
I guess they earn a good living over there for the newest profession.
All right, Dr. Nario, as always, thanks for being with us.
Well, thank you, Steve, for having me today. As we all know that knowledge is power, and thank you for letting me provide you with edge and longevity and health maintenance, which I call the biological edge or the bio edge.